Welcome, everybody. Thank you all for joining us in an important conversation on preschool partnerships. I'm Troy Hunter, the Director of Research, Evaluation, and Performance at Groundwork, Ohio. A few housekeeping items for participation in today's webinar. Today's webinar is being recorded. Closed captioning is available. All participants are muted. Please use the Q&A for questions. We have a full agenda today, so if we can't get to your request or question during the event, we will follow up after the event if you provide us with your email address with the question. All participants will get a recording of the event and materials sent to them via email after the event has concluded. We bring you an impressive lineup to discuss public-private preschool partnerships. We will hear a special update from Dr. Wendy Grove from the Office of Early Learning and School Readiness at the Ohio Department of Education, and we'll hear from a panel of professionals deeply committed to investing in and supporting preschoolers. Please follow Groundwork Ohio and our presenters today on social media and visit our website for more information. We would like to express a special thank you to our funders and partners, W.K. Kellogg Foundation and the Cleveland Foundation. Today's webinar is brought to you by Groundwork Ohio. Groundwork Ohio is a committed, nonpartisan public policy research and advocacy organization formed in 2004 that champions high-quality early learning and healthy development strategies from the prenatal period to age 5. We will work hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. This webinar is a byproduct of the Center for Early Learning, whose goal is to transform early learning policy by removing key barriers to accessing quality early learning opportunities for Ohio's youngest children, improving child outcomes, and strengthening relationships between state and local agencies that implement early learning investments. The last 2 years brought a great deal of attention to the lack of childcare options for families trying to return to work and the impact this has had on businesses in Ohio. The COVID-19 pandemic uncovered many cracks in the social service system, childcare being at the top of the list. A recent report indicates that the nation's infant toddler childcare crisis now costs Ohio $3.9 billion in lost earnings, productivity, and revenue each year. Today, will be joining us Dr. Wendy Grove, Director of Office of Early Learning and School Readiness, and she will be providing us with a special update on the state of preschool in Ohio. So I'm going to introduce Dr. Grove before she joins us today. Dr. Grove is the Director of the Office of Early Learning and School Readiness at the Ohio Department of Education, where she helps develop and implement policies for preschool special education and early childhood education. She oversees a team who is responsible for licensing Ohio's public preschool programs and other early childhood special education programs. Wendy is dedicated to strengthening the systems that support Ohio's youngest citizens. She works closely with colleagues across the state government, advocates, and associations whose programs benefit early learners. As an advocate for young children, she works to increase the knowledge about the importance of early experiences for all children. Before joining the department in 2014, Wendy spent 7 years overseeing Ohio's Help Me Grow home visiting, early hearing and detection intervention, and early intervention programs. Dr. Grove holds a PhD in sociology from Akron University and is dedicated to this field. Thank you for joining us today, Dr. Grove.
Thank you, Troy. Very lovely introduction. Hi, everyone. I have a few minutes to give you a state of preschool update, and I have a couple of things I wanted to highlight for you and would be happy to take your questions as directed in the Q&A. So first of all, I wanted to start with what we know about our pandemic cohort. So there were 3 cohorts that we talk about, those who were 4 years old in spring of 2020, then followed by the 3-year-olds and the 2-year-olds. Believe it or not, those children who were 2 years old when the pandemic began actually started kindergarten in fall 2022. And so we are now with our pandemic 1-year-olds in kindergarten already, which to me is just time flies. But what we do know is that when the pandemic hit, what we saw was a dramatic decrease in enrollment in preschool across the state of Ohio. And in fact, it was almost a 28% decrease of the children participating in a public preschool. Now, we did rebound. By the fall of 2021, we were back up to pre-pandemic levels, at least according to the Department of Education preschool programs. But what we know now is that at least looking at, again, those 2-year-olds who were 2 when the pandemic started and were likely not in preschool for the entire period that they may have well been otherwise without a pandemic. What we know about this particular cohort is that they recorded the lowest percentage of demonstrating kindergarten readiness at the beginning of kindergarten. Only 35.4% of our kindergarten students in Ohio came to kindergarten demonstrating readiness to engage in the kindergarten curriculum. In addition, this same cohort was the highest level of not being on track for language and literacy. And that was topped over 50% for the first time in our state's history. So we will be continuing to follow our young Ohioans in this cohort and others, those directly before them and after, as time goes on, just to see what the impacts were. But in some other news around preschool, this past state budget saw an increase, a dramatic increase in publicly funded preschool investment from the state legislature. So the state was able to almost double the economic investment for our Part Day high quality state-funded preschool slots from 16,600 to over 31,500 slots. In addition, we were able to increase the per slot amount with the input of stakeholders who have told us for many years that the $4,000 per slot amount was not enough. It didn't cover costs. We knew that. And we were able, it was a slight increase, put that up to $4,250 per slot for all 31,000 slots that are now out there and available and being utilized. It's a small but significant increase in order to encourage those partnerships you're going to talk about today for the rest of the webinar, and also to help our providers continue that high quality of education happening across our state and our mixed delivery system that we are so proud of here in Ohio. The last update I wanted to provide for you today is that we are in progress with 2 pilots, again, after consulting with many of you on the panel, as well as others participating in the webinar, where we will be examining the impact of 2 pilot studies within early childhood education. One that will focus on our exiters, those children who age out of early intervention. So for our young children with disabilities who do not qualify for preschool special education at age 3. And hopefully we will be able to show that if we are able to offer them one of these high quality pre-K state funded slots, that we will be able to close the current and persistent gap that we see between children with disabilities and those without entering kindergarten on the KRA. We're also going to explore some other programming standards and some I won't call them rigidities exactly, but some rules and things that people must follow currently without much ability for innovation or flexibility. We don't know exactly what those will amount to quite yet, but there will be public announcements. We will be operating within the over almost 800 now ECE grantees, and then reporting out on those findings as we collect them. So as one more final quick update, as you know, we are operating into a transition for Ohio's new Department of Children and Youth, and under the direction of Chara, who has been named the director. We are working very hard to release a plan around preschool innovations, those pilots that I mentioned, also home visiting expansion, and some other birth to 5 specific initiatives and work that we will begin the transition with. And so more to come around that full transition over the next 18 months into a standalone cabinet level agency, so that we can continue to do better for our families with young children and support them in the ways that they need to do. And so that concludes my updates. I think that your panel today are exactly the professionals who are doing this work every day. And I just want to share my gratitude for all of them. We work closely, and I reach into this group very often for policy input. And so with that, Troy, I will hand it back over to you and watch the Q&A for any questions that come my way.
Thank you for that update, Dr. Grove. I want to encourage all of you or any of you to type any questions or comments into the chat, and we'll have a brief Q&A after our panel discussion. Today, we are joined by leaders across the state who are leading in public-private preschool partnerships. And we're going to go through some questions on what they're doing, what's going well, what's the need in Ohio. Our first panelist joining us today is Robyn Lightcap, Executive Director of Preschool Promise. She is the founding and acting Executive Director of Preschool Promise, a nonprofit in Dayton, Ohio, committed to making Dayton a great place to be a young child. Preschool Promise's vision is that every child in Montgomery County, Ohio, is ready for kindergarten so they can succeed in schools and life. Preschool Promise partners with schools, families, and community leaders to make sure all children have access to high-quality early childhood experiences from birth to age 5. Our next panelist is Chara Fisher-Jackson, Executive Director and CEO of Cincinnati Preschool Promise. Chara Fisher-Jackson is an advocate for children's education and equity, appointed as Executive Director CEO of Cincinnati Preschool Promise in October of 2019. Chara's leadership journey began after a successful term as interim president and CEO of the Urban League of Southwestern Ohio. Her expertise in equity, social justice, and inclusion has reshaped early childhood education in Cincinnati. With a background in lobbying and litigation, Chara has spearheaded advocacy campaigns on crucial civil rights issues. Her commitment to children, youth, and parental engagement in education shines through her work. Her vision for Cincinnati Preschool Promise focuses on high-quality preschool access, ensuring children are well prepared for school. Our next panelist is Shawna Rohrman. Shawna Rohrman is the director of Cuyahoga County Office of Early Childhood and Invest in Children, overseeing an early childhood service continuum from prenatal to kindergarten. She's a sociologist by training and brings this lens to her work to better understand how our social systems shape children's early experiences and environments, and how we can improve these systems to ensure all children have opportunities to thrive. Our next panelist is Katie Kelly, Executive Director of Pre-for-CLE. In this role, Katie leads the implementation of the Pre-for-CLE plan, provides strategic direction to Pre-for-CLE and the early childhood work, leads fund development for Pre-for-CLE plan, and acts as spokesperson and thought leader for early education in Cleveland and at the state level. Previously, Katie served as the executive director at Groundwork, Ohio. She has been involved in many leadership opportunities throughout the state and is a champion for early childhood. Our final panelist is Reverend John C. Jones. John Jones is a proven leader with expertise in diversity, inclusion, board governance, strategic community building, and leadership development. He is the president and CEO of Hope Toledo, a nonprofit organization dedicated to the premise that strengthening education will increase opportunity for all Toledo's children and youth, grow prosperity for its residents, and improve the future for our families and neighborhoods. John leads Hope Toledo's focus to advocate, support, and ensure equitable access to high-quality education for Toledo's children by expanding high-quality early childhood education for Toledo's 4-year-olds. I want to first thank all of our panelists for joining us today. Our first question I'm going to direct towards Reverend John Jones. What inspired your organization to get involved in preschool partnerships, and what specific goals are you working at towards in the field?
Thanks, Troy. So just to jump in, I do want to say just a quick thank you to Groundwork for pulling this together, because obviously the more we can talk about it, the better. So to answer your question directly, we are, as I like to say, sort of the baby of the group, no pun intended. Here in Toledo, we literally have launched our Hope Toledo Pre-K demonstration program and a few other initiatives around early childhood just 4 short years ago with our planning work. And what we saw, 3 different things. One was we saw a distinct need, and we've already talked about KRA scores and things of that nature of kids and where they are at the demonstrating level on the KRA. And in Toledo, we were no different. Our numbers pre-pandemic were around 19 or 20%, approximately, of kids leaving preschools or entering kindergarten not ready to learn. And so that number post-pandemic, if I can say post-pandemic, is sitting hovering right around 15 or 16%. So for us, that was an alarming need, and there was a lot of discussion around it. The second thing is that we also knew in Toledo that we needed a collective approach that was comprehensive and community-based to get us down the road. When we looked across the state of Ohio, and I got to give nods to our colleagues that are here on this call and others who have been doing this for quite some time already at a high clip, our leadership in Toledo really felt that there was a significant need for us to pull together a coordinated approach around this. We have some excellent providers of early childhood care. That is a fact. But the connection is not exactly what we would want it to be across our entire sector. So that was the second reason. And then the third reason, I think, was really this concept of what does our workforce look like of the future? And so if we really want to have the conversations around being that city, being that community that is developing and also a great place not only to live, but to work and to play, workforce has a significant component of that, and our employers need to be able to pull from our local talent to do so. So we believe at Hope Toledo that a strong start literally leads to a strong future. And so for us, it was really those 3 drivers, and there's a lot more, but those are 3 of the big drivers that inspired us to take those steps and make those moves.
Thank you, Reverend Jones. I want to direct that same question to Katie Kelly.
Thanks. It's great to be here with everyone. So yeah, we in Cleveland, I think, echo a lot of what Reverend Jones spoke to around, really thinking about how do we take this issue on in a more coordinated way as a community. So our initiative, Pre-for-Cle, actually grew out of the public schools, the Cleveland school districts transformation plan that was launched in 2012, and it was at the time kind of an outlier as far as really taking on a bold new approach in some areas, having to get legislative approval for some parts of the plan. So it really was a very significant and comprehensive transformation plan for the school district, and part of that work was really thinking about how all 3 and 4-year-olds would have access to high quality preschool in order to, increase kindergarten readiness and support the whole goal, the rest of the goals of the plan. And so that's really that goal really developed into what is today Pre-for-Cle, a collective impact initiative working to do just that, expand access to all 3 and 4-year-olds. And a couple of things I think that we started with and that we have realized have been really important all along the way. And one is to really build on what's already in the community. We were really fortunate to, start this initiative in a community that already had a county office of early childhood, and Shawna Rohrman, the director of that office, is here with us today. So a long time commitment from our county, a lot of commitment from our philanthropic community, and a wonderful R&R organization, and just providers who are really committed to this work. And so really thinking about, not just starting something from scratch, but really thinking about what are the assets and resources that already exist in your community, and how do you build on the work that's already happened and connect your work to those early childhood partnerships. The other thing I think we think about is supporting the whole early childhood ecosystem while you're thinking about preschool access. So as we all know, it's very complex. What we do in preschool impacts infant and toddler care and out of school time for older children. What we do inside public schools impacts the community-based providers. So really thinking about those policy decisions and levers that you're pulling, what impact are they going to have on children throughout this early childhood system? And how do you make the right decisions that support children and families in the best way possible, and support a strong system across all of those settings? So that's another thing I think that's really important to think about. And then finally, just, creating a space for really honest dialogue. These can be really difficult conversations in a community, especially when you're thinking about balancing priorities and needs. And so creating that space where partners can come together, talk about different barriers, talk about different opportunities, and really have honest dialogue on how to move the system forward, and figuring out a way to do that that's right for your community. So I think those are three big points that we would have for people thinking about establishing these kind of partnerships.
Thank you, Katie. Katie, what advice or insights can you offer to other organizations looking to establish similar preschool partnerships in the state?
So, I think on top of my previous comments, a couple other things that were helpful to us, really using data from the beginning to look at, things like where are children accessing preschool across your community? Where are there areas where there is less availability? Where do children live? So making sure that, you understand access by neighborhood and where children actually reside. How are your preschool programs impacting kindergarten readiness? That one can be trickier if you don't have the right data agreements, but really working to look at over time things like access, quality, and kindergarten readiness outcomes. Those are things that really helped us understand how to shape our initiative over time. And then, really just thinking about, where you want to focus your efforts, where you have the most opportunity to leverage resources that exist in your community, and then how you want to work with partners across the state. I think it's been incredibly helpful to have the colleagues on the meeting today, and also others across the state who are doing similar work, having these kind of conversations to see how other communities are shaping their initiatives and figure out what works, what you can draw from those examples to look at your own community.
Thank you, Katie. Reverend Jones, what advice would you have?
I would obviously ditto all of what Katie just shared, but I would underscore for those that are maybe contemplating doing this or at the early stages of doing this. I cannot say enough. There is not a need to reinvent the wheel. The good folks on this call, and I can say without fear of contradiction, each one of them I've talked to individually. So fortunately, they still take my phone calls. But each one of them have been a wealth of information. There's a group that gets together on a regular basis, things of that nature. I don't say it because we're on a Groundwork sponsored call, but Groundwork has been extremely helpful inside of that effort. So I would say to all the folks that are listening, don't don't go about trying to reinvent the wheel. There's a lot that's out there. There's a lot of best practice. The second thing I would say is get started, right? Don't delay, because literally, without fear of contradiction, our kids cannot wait. And so as we think about the need that exists and what's there in our communities and all of that, get started and get to moving. And then last but definitely not least, which Katie really addressed well, but I would say be practical, pragmatic, and really comprehensive in your approach as you're looking at the data and as you're pulling information. Really think about those practical and pragmatic ways that you can include community, right, inside of these conversations. Don't do it without community. Yes, the need is there and you can point to all those things, but if a family or childcare providers or others are not there inside of that mix, then, you know, it could be closer to an epic fail than the epic success that it could be. So I would say really those three things would jump out at me.
Thank you. I'm going to direct the next question to you, Dr. Rohrman. In your experience, what are the most pressing needs of preschool age children you serve, and how does your program address these needs?
So what we hear quite a bit from our providers and other partners in the community is the need for support for children's social and emotional behavioral needs. And this is something that we saw increasing prior to the pandemic. And I'm sure most people on this call would agree that these needs continue to rise, both in frequency of need as well as, it seems, intensity. So our office, we're very fortunate here in Cuyahoga County to have a really robust support system for early childhood, both sort of philosophically and financially. And so through the Office of Early Childhood, we work very closely with our local CCR and RS, Katie mentioned, Starting Point, to implement a program called Prevention and Inclusion Programs, which is essentially, and for the most part, geared at addressing social and emotional needs of children in the classroom. We have a couple of different kind of ways that plays out, but it's technical assistance in the classroom. ECMH consultation is a big piece of that. So through funding from Cuyahoga County, we're able to support services to about 1,600 kids per year in the classroom setting, and that's across the county. We also have, as part of our larger early childhood mental health system, we have in-home and in-community services that are not specific to preschool children. They are for children 0 to 5, but we see a lot of preschool children needing those services beyond the classroom in the home. And so we're very fortunate to have the resources to provide those, and yet still know that the need is there. We have wait lists that we're whittling them down, but as is the case with the early childhood education profession, the early childhood mental health field is really suffering in terms of its workforce, behavioral health more generally, but we are trying to sort of do what we do at the system level as well by working with our funding partners in the county to address the workforce shortage and identify ways that we can bring folks to the field to get kids the services that they really need.
Thank you so much, Dr. Rohrman. I want to direct the same question to Chara. In your experience, what are the most pressing needs of preschool age children that you serve, and how does your program address these needs?
I think, echoing what my colleagues had to say, I think the most pressing needs we recognize are that a quality education for our youngest learners doesn't begin just when they get inside the preschool classroom. And I think looking at it from the perspective and the lens of a whole child and a whole family is critical. We've seen some children grow with growing needs for that social emotional learning, but we've also seen a growing need for family and parent engagement to convince them, to share with them the benefits of early childhood education so that they consider preschool as an option, particularly in a post-pandemic world. And so working in our community to say, how do we help our community providers navigate what is available in the community and resources that they can tap in that support them doing what they know best, which is educating children and connecting with families to make this an overall holistic experience that gets a child ready to thrive.
Very powerful, Chara. Robyn, how would you answer that question?
So I think I would echo what Shawna said about just the importance of creating safe social emotional environments for our children. And we've invested a lot in conscious discipline as our framework, and we've found a lot of success with our teachers. We've had hundreds of teachers go through that training, and we provide coaching around it. But the other thing I would say, in addition to that, just this morning I was visiting one of our providers, and she has a child that she believes is on the spectrum, and she's like having to say to the parent, I just don't have the resources to serve this child. And I know this is something our leaders at the state departments are working on with things like the new Ohio Promise, with the inclusive credential that programs and professionals can receive. But we all know that it's going to take financial resources to be able to have people who can come into especially childcare settings and provide the specialized services that school districts receive for preschool age children. So I would just say that's a huge need that is coming up. Just like Shawna said, it was happening before the pandemic, and it's even more intense now on this side of the pandemic. Obviously, speech language delays are very important for us to address in these early years, and they can be addressed, but we need people who have that specific training that can go into various settings, because our children, it doesn't work for them all to go to a public school setting that is only during the school year and only part day. And then the other thing I would just say is that from our data that we collect on child assessments, and if you think back to what Dr. Grove shared at the beginning about only 35% of our children across the state demonstrating readiness, the early literacy skills are critically important. And we are seeing just a real challenge in children being able to identify letters and beginning sounds and rhyming, all of these things that we know are very important. Obviously, vocabulary development being critical in these early years. So I don't want to miss that too, because in addition to these specialized needs, we have some basic things that we need to continue to focus on as we implement curriculum. We think about the science of reading and the importance of the early years and supporting the science of reading. That can't go unrecognized.
Robyn, how does Preschool Promise promote equitable outcomes for all children, and what challenges have you encountered in doing so?
So just like all of my colleagues here, we are constantly looking at our data, disaggregating it by gender and by race and ethnicity. And just like everyone in our country, unfortunately, what we consistently see is we do not have good assessments that can accurately reflect all of our children's skills. So acknowledging that we end up with biased assessments, we still also know that on these assessments, there are things we want all of our children to be able to do, like what I was just saying, identifying letters, beginning sounds, et cetera. And we see consistently that our children of color, and in our community, specifically our Black children, are scoring on the lower side on these child assessments and going off the charts on expulsion and suspension at disproportionately higher rates. So this is not a new trend. This is something our country has seen forever. And several years ago, I was looking around our table at Preschool Promise in Dayton, and I realized, we've got a lot of really smart, great people working on this. But when you look at the data, our Black boys are consistently showing up needing, like we can tell the system is failing our Black boys. And so we realize we have no Black men at our table. There are very few males in early childhood education, and especially our Black males, and especially in the classroom. So we went out and intentionally recruited. We had 15 Black men who met monthly for a year and gave us recommendations as Preschool Promise on what do we need to do differently to figure out how to prioritize the needs of our Black boys. And we ended up hiring one of those men to join our staff, and he's now leading an umbrella of initiatives that we call Black Boy Brilliance. And that would be one example. We're currently right now screening a documentary that's called Black Boys, and we've had about 300 of our Preschool Promise partners go through or watch the film, as well as many other community partners. But that's a specific thing that we're doing, lots of training around creating Black boy friendly classrooms. And it's about us as adults and us as the people delivering these services. It is not about our children. It's definitely about what we need to do differently to create environments where they thrive. So I would say we just are unabashedly addressing it and saying this is a problem. We can't keep talking about it. We can't keep looking at charts and going, oh, that's terrible, because it's been like that forever. So it's time that we actually put things into place that we're acting on to change what's happening in the environments that support our children.
Thank you. Dr. Rohrman, how would you answer that question?
I mean, I echo everything that Robyn has said and said so well. We're seeing, similar patterns here, as is the case across the country. Unfortunately, again, a problem in the Midwest, a problem nationwide is the co-occurrence, right, between segregation and poverty. And you're seeing most of the children who are lower income are also minoritized in their communities. And so really, we are working again with our partner Starting Point to address what Robyn has mentioned about specifically the higher rates of expulsion and punishment for Black children, and specifically Black boys. We're working with a consultant from New Orleans and her team on a kind of innovative professional development experience. We aren't really sure what to call it yet. It feels like an experience that is aimed at reducing these disparities in punishment and expulsion. And the way that we're doing that is through what we're calling racial identity processing groups for teachers and administrators and staff of preschool classrooms and early learning centers. And so the idea of this professional development experience is that early learning staff go through a racial identity processing group separated by racial affinity to sort of explore what that racial identity looks like in their life. And when we get to the pilot phase, we will be incorporating elements of sort of the experience of teaching an early learning classroom and how your racial identity comes into play in that classroom, whether you are a white teacher, a Black teacher, a Latina teacher, whatever the case may be. How are you interacting with students in your classroom, and where are biases showing up? So we're really excited about this project. It's intense and intensive. And so we're starting with small numbers, but we are really excited about the possibility of scaling this. We're already seeing, reductions in racial bias among the participants who went through the pre-pilot phase. I was one of those participants. It was a really powerful experience. So that's a project that we're working on right now that's still really in the beginning phases. The other thing I would say is we view access as sort of the critical first step to achieving equitable outcomes. And so one of the ways that we're able to improve access for all children is through our scholarship program with Universal Pre-K, where we offer 50% and 33% scholarships to families that are 400% of the poverty level or below. So that's something we're really focusing on with our next request for proposals process, really thinking about what does it mean to have access to high quality, not just through scholarships, but what kind of sites are we pulling into the Universal Pre-K program, non-traditional hours, things like that, to really sort of broaden what we typically think about in terms of access.
Thank you, Dr. Rohrman. Speaking of equity, Chara, can you tell me, are there particular groups of children who are often left out of the conversation when it comes to preschool partnerships, and what steps can we take to make sure that we include them?
I think we've found in looking very closely at our data that families who don't have safe and secure housing, families whose children who have behavioral challenges and are dual language learners are frequently left out of that conversation and have limited access. And I think being very intentional, as you heard from my colleague, about how we put an equity lens on everything. And those people are often left out of the conversation. Many people are left out of the conversation, and the access is limited because in many cases, when we are looking at these partnerships and how we build preschools, there are administrative labels and requirements and restrictions that often prohibit us from providing that true access, because we are very focused on how we administer it, how we fit in certain categories. Our team has made the commitment to say we need to be innovative in how we expand that access. Of the families that apply for tuition assistance and financial support for us, we're able to approve almost 93% of those families, and we're very proud of that. But that is because we don't have an automated transactional system. It requires legwork. It requires relationships. It requires community involvement, engagement, not only to have those people, those individuals, all of our families. And by those, I mean those who have the most at stake with our youngest learners, all of us in the community, to come together to not only say, how do we have that conversation, but how do we make sure that there is influence and decision-making behind those conversations. And so when our families came to us and said, this process is too complicated for us to do, we don't understand how to fit into all those categories and our children are being left behind, what we said is, how do we fix that? And that is the encouragement I would give to everyone. There is always a way to find an innovative solution to make that equitable access possible.
Again, very powerful, Chara. Robyn, how would you respond to that question?
Which part of it? Can you be more specific?
Yeah. Do you think there are particular groups of children who are left out of these conversations when it comes to preschool programs?
I mean, yes, like we've been talking about, especially those that have some sort of delay or special need. I think that's what's so often left out, because we think, okay, it's great, we have school districts that can provide funding once they hit age of 3, but it does not meet the needs of all of our families. So like Chara said, we just have to be more inclusive in how we design the funding streams around serving our children and try to make them more integrated so that everybody can access them and the places that families most want to send their children. That's the big thing, I would say.
Thank you. And speaking of all, the different initiatives that we talked about today and the work that everyone's doing, sustainability is key for long-term impact. So, Katie, what would you say are some strategies that you have in place to ensure sustainability of your preschool partnership?
So part of our partnership is bringing together the school district, the city, the county, philanthropic partners, and a whole host of other community partners, and our R&R starting point to do this work together. And so I think part of just the sustainability of continuing this work is having that continual convening, making sure that we still want to continue with the partnership the way that we've designed it as a community. We also have a set of community level goals that we call the Pre-for-Cle plan that are co-created by that group of partners that we convene to really think about what are we aiming for as a community around preschool access, quality, and sustainability. And so those are the goals that we create together. They're about a 5-year horizon, and those are sort of our guiding documents and goals that we continually use to sort of implement this work. So that's kind of the framework that we've created here in Cleveland. And also just, part of that work is a lot of awareness building in our own community about why preschool matters, how we're doing against the goals that we've set as a community around access to quality early education. So that continual drumbeat of outreach to the community in different ways through our own communication, through the media, through different platforms, to make sure that the community is thinking about these issues, that it's thinking about why preschool matters and why we need to keep working together to solve these big structural issues around preschool. So those are some things. And then also, from a financial sustainability lens, I mean, the work that we do directly as staff is philanthropically funded, but a lot of our effort goes towards increasing public funds for high quality preschool. So, we invested from the beginning of our initiative in advocacy to make sure that we can be thinking about advocacy at the federal, state, and local level, really building that support among all of the policymakers at all of those levels, and thinking about the many different funding streams that go into supporting preschool in its various settings. And so, thinking about, as you build your initiatives, what kind of advocacy support needs to be there. And, I think a lot of people think advocacy, lobbying, kind of a dirty word, but it really doesn't have to be, it can be all of those things. It can be awareness building, building support among policymakers, thinking about how you do this work in a way that can sustain support in many different ways. And so, I think thinking about not just the work, but then how do you talk about the work? How do you build awareness of the work? And how do you make sure policymakers understand the importance of what you're doing?
Thank you. Dr. Rohrman, what strategies do you guys have in place for sustainability at Invest in Children?
So we Invest in Children is staffed through the Cuyahoga County Office of Early Childhood. And so as a government office, our funding specifically toward UPK, but also toward our work with Starting Point to support the early learning system more broadly, that those programs are levy funded. So we are fortunate to have the support of our community to have increased our Health and Human Services levy most recently in 2020, which has allowed us to sustain an expansion of the universal pre-K program that happened in 2017 when we doubled in size. But this has been, it has been a slow growth. We started universal pre-K in 2007 with about $2 million in funding and about 1,000 seats in that program. That's an enhancement program built on top of existing high quality preschool. Since 2007 up till like literally right this minute, we've grown from 1,000 seats to just under 5,000 seats and have increased our budget a little over fivefold. And so that is directly due to support not only from taxpayers, but also from the county administration, the county executives that have been in office during the duration of universal pre-K, really supporting the work that we're doing. But one really important piece of how we are continually able to sustain not just UPK, but really all of our programs is through evaluation of our programs. So it's really important to us to be able to demonstrate a responsible use of taxpayer dollars and to make sure that that funding is going toward the biggest impact. And so we, several years back maybe about 4 years now, did an evaluation of our universal pre-K program, where we found that kiddos who are going to preschools that are part of UPK have higher rates of being on track for language and literacy, have higher rates of kindergarten readiness compared to kids who don't. And so having those data to be able to tell that story was incredibly important to gaining the support of the county administration in dedicating additional levy dollars to the UPK program in 2005. And a lot of what Katie said, obviously, because we're in the same community, applies to our office as well. We, though, because we're a government office, advocacy is not our number one sort of task. And so we are fortunate to have Pre-for-Clee in the role of leading on advocacy because it allows us to sort of be flexible and to get into the game a little bit when we need to, like we did around budget season. I feel like I'm rambling a little bit.
Thank you, Dr. Rohrman. We are running a little bit tight on time, and I want to make sure we have enough time for the Q&A. I am going to ask, John, I'm going to ask you, Reverend Jones, to answer this question, and then I have a follow-up question from the Q&A box. Let's start with what kind of support and resources do you need to continue to do your work effectively? And then follow up that with, there's a question around you mentioning that Hope Toledo is the new kid on the block. And in your opinion, and the experience of the other presenters, how long does it take for the entire community to accept, embrace, and encourage the full acceptance of this work? So I think those are good questions that kind of tie in together your response. What are the resources and support that you need, and how long does it take for the community to fully accept the work that you're doing?
To answer the first part of your question, funding is critical as far as resources that we need. And I do not say that cavalierly at all. The work cannot be done without that. And if we really do believe that our children are our future and we should be investing in them and all those different things, we've got to come up with a mechanism that allows for that funding to happen. Appreciative to the state for the increase in the dollars that we see going towards childcare providers into the early childhood sector. But to be very honest and respectful, it is still woefully lacking. And we have to, call that out and say, that we need to do more. The other thing that I see is, as far as resources, are really local resources right there in our community. The collaborations are critical. We've talked a lot about that on here, how collaborations are happening throughout the state in our various locales. I think that is a big, big, big deal, particularly from the business community and the business sector, because this is the workforce that we're developing. And it's not just the workforce that we're developing, i.e. young kids, young children going into the space. We also have to value the teachers that are in the workforce, and without them, the workers that have to go to every other job, whether it's in healthcare or industry and manufacturing or any of those things, if they don't have quality places to take their children, we're struggling. So I think that collaboration is really crucial. To answer the other question, I did see it in the chat. I'm sure my colleagues can probably answer this a little bit better. I will say, being 3 years in the game, we are beginning to see a significant uptick as it relates to support in and around the work. I'm not saying that we are arrived. So that question of the entire community, I don't know if the entire community ever gets there, but what I will say is that we are seeing that because of solid work, solid planning, solid communication, solid inclusion and engagement, we are beginning to see a whole lot of people rallying around this effort to say, okay, how do we really get this done for our community? And some of that is due to the excellent work that's being done by our childcare providers. The team at Hope Toledo is a phenomenal team that I cannot speak to highly enough. But it's also the season and the time that we're living in, and how do you maximize each of those moments? And so that's really where we are. I don't want to say 3 years is the magic number, because it is not. But we are seeing, after 3 years, really solid engagement from community leaders and partners saying, okay, how do we help you get this done? How do we help move this needle forward to serve our children? And I'm sure my colleagues have even a better answer for that.
Yeah, I'm going to direct that last question again to Chara, and talking about what kind of support or resources do you need to continue work effectively? And then we'll jump into the rest of the Q&A questions.
Well, I think that Reverend Jones said it perfectly. I mean, I think we all shy away from and sometimes don't talk about that it is consistent, expanding financial resources is what is needed, right? And I don't think I could say that message more clearly. We rely on collaborations, but at the end of the day, there has to be an infusion of cash resources to stabilize and continue what we know needs to be done in early childhood education.
Thank you, Chara. And there's a couple questions in the Q&A. I'm going to pair a couple together. Lisa asked, can you share any efforts to support the workforce, recruitment, retention, and career pathways? I'm going to attach that with also, how can we attract high quality teachers in rural areas in Appalachia and compete with school systems for teachers? So that's an open question to any of the panelists that want to answer.
Lisa, I don't know if we've talked before about what we're doing in our community, but we have a scholars program where we're helping people pay for getting their CDA, their associate's degree, their bachelor's degree, and we've helped some with their master's as well in early childhood education. They have to be working at one of our Preschool Promise partner sites, and then we help with their education and books and mentoring, tutoring support. So that has been helpful. It's a way that people can attract and retain staff as well. But all of us know that it takes increased investment to make this this career pathway viable, financially viable. So we have to keep advocating for that. And the person who shared the the pain of finding somebody in a rural community, I feel your pain. I don't have any great solutions on it, but I think looking for ways, other benefits, if you can find a funder who could help this person continue their education, pursue their master's, whatever it might be. Flexible jobs, that's something some of our providers are playing with a lot. I'm sorry, flexible schedules, because in order to compete with everybody else who's doing flexible scheduling, we have to look at that in our field too.
Chara, did you want to answer that question?
Yeah, I think similarly, we have also tried to harness grant funds and sources, not only for education completion at that crucial time in the last semester when people are struggling to complete, but also a grant system that looks at providing resources or a specific stipend for our community providers and preschool sites to use those funds in the way they deem best, really to address the pain points that are around human resources, and that is benefits, that is wages, and ongoing education, because we found that those are the three most crucial things, and to offer some flexibility on how any of those things could be the point that increases the recruitment, and not only that, but retention. And our grant program really focuses on what is the additional support or small stipend that we could give that may incentivize a teacher to stay and remain and continue as a preschool teacher. So it is a trajectory of recruitment, but also one of retention. And I think on both of those points, it's crucial to try to establish a way that we can fund and resource that, because sometimes it feels like we're fighting a losing battle. And I think, as Robyn said, all of us on this call are open to innovation and new ideas, and maybe trying things that are outside of our traditional context of what we look at in a workforce lens of education and preschool, and relying on our partners in manufacturing and other places to say, how do we expand what the workforce looks like, and what are those techniques do we try? Because it is a new world. And that we have to find different resources in different ways to tell people how great this profession is, and also make it not only beneficial, but the concept of not just breaking even and struggling, right? That we provide a living wage, not just an equitable wage, and how we can do that.
Thank you so much for that, Chara. We are out of time. I saw a few more questions in the QA specifically around the expansion of the ECE grant slots. If you want to go ahead and put your email into the Q&A, or you can email me at thunter@groundworkohio.org, and I can help talk through some of the answers for that. Thank you to all the advocates, partners, and policymakers on this webinar today. We're hopeful that this conversation gives you some things to think about and some action steps that you can take into your local communities. As Groundwork's Ohio Center for Early Learning continues the conversations of healthy development for young children, we invite you to join us as a partner and ally. I also want to again thank all of our presenters and panelists for being here today and sharing their insights and their passion and dedication to early childhood across the state. For more information on Groundwork Ohio or the Center for Early Learning, please visit our website. You will be prompted to answer a survey at the end of this call. Please answer it. That information helps give us feedback and to help serve our partners and stakeholders better. Thank you all for joining us, and have a wonderful afternoon.